Epilepsy is a disorder in which nerve cell activity in the brain is disturbed, which in turn causes seizures. It is very common as it affects about 3.4 million people nationwide and 50 million people globally. Epilepsy may be genetic or due to a brain injury such as trauma or stroke. The main causes include low oxygen during birth, brain tumors, head injuries, infections such as meningitis, and autism. During epileptic attacks, excessive and abnormal brain cell activity happens. This brain activity can be seen in waveform using EEG graphs. EEG is a test that detects electrical activity in the brain using electrodes attached to the scalp. This activity is communicated by impulses and are active at all times, even when you sleep. Doctors use EEG graphs to view a patient's brain activity and give an appropriate diagnosis and treatment.
Before we address the solution, we have to first delve into technological advancements progress. The epilepsy field has a greater demand for devices to monitor internal activity within patients. This led to the creation of monitoring devices, which do include wrist accelerometers, heart rate monitors seen in smartwatches and wristbands, surface EMGs, and many more. With the increase of data monitoring, one question does remain. How will we manage all this data? As of right now, data is being read and stored indefinitely, and this does include the good, the bad, and the irrelevant. Now, neurologists all over the world will have to go through days and days of data to find relevant data, which in some instances, there might not even be any. Smart Eeg is a desktop application where it is able to analyze monitoring data and evaluate the risk levels of seizure events that occur. Smart Eeg is then able to categorize and display relevant data, which includes pruning and discarding irrelevant data. With this application, we prune out irrelevant data, which then decreases the amount of data neurologists have to go through to analyze, thus decreasing time spent in analyzing this.
Smart Eeg is an application with the goal to aid neurologists by pruning down large amounts of monitoring data to digestible segments. Smart Eeg accomplishes this by reading a raw EDF file and by using seizure detection device alarms is able to assess the likelihood of a seizure event and selects data with medium or high risk.
The design of the Smart EEG is fairly simple. First, we take the EDF file input from the user. Then the Smart EEG reads in only seizure events. This does include the 15 minutes prior and the 15 minutes after a seizure event does occur, or all data that indicates that no seizure event is going to occur is then discarded from the file. Then the Smart EEG creates new files with the pruned data set. After this processing is over, the program will then display an EEG signal of the pruned data set.
Our project timeline was split into two distinct halves. For the first part of the project, we focused on functionality. We wanted to get the most important aspect of our project, the data processing, finished first. For the second half of the project, we focused on usability and design. One of the first major hurdles that we had to overcome was that the .edf file format had multiple different standards and versions that the data could be formatted in. We found out that the library that we were utilizing required a different format than the format that our client system was outputting. In order to solve this, we researched the differences in the formats and developed a conversion function.
In regards to the visual aspect of the Smart EEG, we came across an obstacle in regards to reading in the EDF file into the user interface. The solution that we came up with was to manually have the user input the name of the file with the requirement of it being an EDF file into the Smart EEG. Another obstacle we faced was reading in the data from the EDF file created by the Smart EEG and created so the user can have a graphical visual of the data. A way that we were able to fix this solution was to use Qt Designer in Visual Studio's 2017, which is an IDE. We then used Q Custom Plot, which provided a more flexible and efficient way to read in EEG data from these files. With the combination of using Q Custom Plot and the EDF library we were using to read in and get the data from the EDF files that we created, we were able to create an accurate view of the EEG data for the user.
With our program Smart EEG, doctors will be able to better focus on the patient and treatment required. Instead of spending hours looking through unnecessary data trying to find the important trigger points, Smart EEG will allow them to focus only on the data in which possible epileptic seizures occurred. Smart EEG will have such a positive impact on the industry as it will dramatically reduce the amount of time doctors are spending looking at data, as right now it could be a week's long worth, and by pruning that data it could be only a few minutes up to maybe a few hours.
Future implementation of the project would have the Smart EEG program running live on an EEG machine, pruning the data as it comes in. Other possible improvements would have the user interface improved, giving neurologists that review the data more tools to manipulate the data.